recommendations for when we should definitely go to the urgent care clinic versus just waiting?
Yeah, a couple things. So one would be most of the time, there is a little overlap between the urgent care centers and when your generalist is open. Most of the time, most urgent care centers open, mid to late afternoon, and then are open until sort of the later evening hours, definitely before midnight. So we have I think people would call that sort of like a swing shift, right? And so typically for most pet parents, option one is to call your generalist and just sort of talk through the situation, or even the urgent care center themselves, and describe what's happening. This is what I've seen my dog or cat do. This is how many times the dog's had diarrhea. This is what it looks like. And they'll ask you some what we call teletriage questions. So questions that help us discern over the phone or over a video call the stability of your pet. And to their best knowledge, they will help direct you whether this can wait till the morning, or this should be seen tonight by an urgent care, or this seems life-threatening. You need to get to an emergency clinic. And I want to give a little bit of rest and take some weight off the shoulders of the pet parents listening. When in doubt, always err on the side of caution. An emergency clinic will always see you. Will always see you. The issue that we have with the pandemic pet explosion through COVID is that emergency clinics often will have longer wait times, especially if your pet is not at that highest level of emergency triage. So as an example, if your dog's been scratching at his or her ear all day, but everything else seems fine, but we obviously don't want that dog to be uncomfortable the rest of the night, an urgent care center would be more efficient for you if there's an urgent care center available. If you went to an ER, they would absolutely see your dog, but there might be a pretty long wait time while they see hit by cars and bleeding abdomens and toxicities and all the other scenarios I mentioned. So it's just something to keep in mind.